അപ്പോൾ ഞാനിത് അടുത്തത് ഓസ്കിയുടെ ഞാനും എൻ്റെ ഹസ്ബൻഡും കൂടി പ്രാക്ടീസ് ചെയ്തതാണ് അടുത്ത വീഡിയോ. അപ്പോൾ നിങ്ങളത് കാണും. As I enter the room, checking for safety, there is no hustle. I'm happy to approach the room. Both patients, privacy and dignity. I'm just drawing the curtain. As my hands are visible again, I'm just using that.
Alarm വെച്ചില്ല. അലാറം വെക്കാണ്ട് പോകുന്ന പറഞ്ഞ പോലെ രശ്മി അലാറം വെക്കാൻ ഞാൻ എനിക്കറിയോ.
Okay. As I enter the room, checking for the safety, there is no hustle. I'm happy to approach the room. For the patient's privacy and dignity, I'm just drawing the curtain. As my hands are visibly clean, I'm just going to use the alcohol gel to clean my hands. Palm to palm, palm of the dorsum, palm of the dorsum, fingers in the place, fingers in the lock, fingers in the lock, thumb rotation, just tips of the fingers, tips of the finger, wrist to elbow, and I am allowing my hands to dry for 30 seconds. Good afternoon. My name is Rashmi. I am a staff nurse who is going to look after you today. I am here to give you tuberculosis inhaler medication. Is that okay with you? Okay. Before that, I just need to make sure that you are the right patient. So I have to cross check with my case notes with your wristband. Is that okay? Can I touch your wristband?
Yeah.
Okay. Can you please tell me your full name? Date of birth?
30th May 1976.
And the hospital number is 224433. And have you got any allergies? Damipred. What will happen if you take Damipred?
Itches.
Okay, I will make sure that during your stay you don't have any Damipred medicines. Okay, is that okay? Okay. Before I go and collect all my articles ready, are you comfortable? Are you in any pain?
No.
Do you want to go to the toilet before I go? Okay. Here is the call bell. If you need anything, just ring the bell. Okay. So I'm just going to do my hand hygiene, and then first I'm going to review my medications. The right patient is Bernardino Ramos. The right patient is Bernardino Ramos, and the right medication is beclomethasone 400 mcg per puff. So it's the right medicine. Beclomethasone 400 mcg and right one. Okay, and the right dose is 2 puffs. And the right time is 12 o'clock. It's the right time is 12 o'clock. And the prescriber's name and signature is present. The prescription is valid and legible. I'm happy to use this one. So the medication is beclomethasone. The expiry date is 2022 of August, and this clean and tidy and ready to use. So. And then I have got my spacer. It's already clean and tidy. So I'm just going to take that one. So I'm doing my hand hygiene again, and I'm going to wear my gloves and apron. Spacer with me. Okay, I'm back with your inhaler medication. Are you still comfortable? Can you please confirm your name and date of birth? Hospital number is 224466. Have you got any allergies?
No.
Okay, so have you used the inhaler before?
No.
Don't worry, I will explain all the details. Okay. So I have followed all the 6 hours while preparing the medication. Okay. So I will explain you everything. So I'm just doing my hand hygiene again. So this is the spacer. So you have to connect the inhaler this part. Okay, like this. Then before you connect the inhaler, you have to shake that one for 2 to 5 seconds by holding like this, 2 to 5 seconds. Then you have to connect that one in this front, okay, like this. Then you have to open the cap. So make sure you are always in a comfortable position, like you can sit upright in bed or sit upright in the chair. So which position you prefer?
Upright in bed.
Okay, you can just, I will just make sure, adjust the bed so you can sit upright. Then what you have to do, you have to hold the inhaler like this, then keep horizontally. Then you have to press the canister and breathe in through the spacer device and tilt the chin back. Then breathe in deeply through the mouth and breathe out through the spacer 5 times. And the last, when you do the 5th one, you have to just exhale through the purse lip. Okay, is that okay? So are you comfortable to do the inhaler? Before that, I have to say you have prescribed for 2 puffs, so I have to give you the 2 puffs. First, after the first puff, I have to wait for 20 to 30 seconds because it's the same medication. If it is a different medication, you have to wait for 2 to 5 minutes. Okay. So are you ready? Can you please sit upright? Okay. So you have to do these 3 things at the same simultaneously. Okay. So you have to just press the canister fully and breathe in through the spacer, tilt the chin back and breathe in and breathe in deeply through the mouth and breathe out through the spacer for 5 times. And the last breath, just exhale out through the first lip. Okay. Okay, I'm just taking it out and wait for 20 to 30 seconds. Okay, the 20 to 30 seconds is over, so I'm just giving you another one. So okay, just press the canister fully, breathe in through the spacer, tilt the chin back and breathe in deeply through the mouth and breathe out through the spacer and breathe in normally 5 times. The last time, breathe out through the first lip. Okay, so all done. Are you comfortable? Are you fine? Okay. Okay, I'm just going to clean the inhaler and spacer according to the manufacturer's instruction. Okay. Are you still comfortable? Do you want me to do anything before I go? Okay. One more thing I have to say. This is the you have to take the bronchodilators. If you are due for any bronchodilators, you have to take bronchodilators first, then the steroids. Okay. Are you okay now? So here is the call bell. If you need anything, just ring the bell. Okay, I'm going to document in the your care plan. I have given your medication in the right time. I'm just going to sign it. I'm going to remove my gloves and paper. And doing my hand hygiene and doing the documents. I'm going to sign. I'm going to date. I'm going to do the time. My name, the signature, date, time is done. Okay. Thank you very much for your cooperation. I have completed your giving inhaler medication. Okay. So finish.
ഞാൻ ഇവിടെ ഒരു ടിക്ക് വായിച്ചില്ല, പക്ഷെ ഞാൻ ലാസ്റ്റ് പറഞ്ഞു. നീ ഇപ്പൊ സ്റ്റോപ്പ് ചെയ്താണോ?
സമയം ഉണ്ടാകുന്നു.
എനിക്ക് നീ ആ മറ്റേത് തന്നെ എനിക്ക് അറിയത്തില്ല. അതെന്നാ എനിക്ക് അറിയത്തില്ല.
ആ സാധനം ഇല്ലല്ലോ, അതെനിക്ക് ഞെക്കാൻ പറ്റത്തില്ല. ഇതിങ്ങനെ ഇവിടെ ഇവിടെ നമ്മൾ ഈ ഇൻഹേലർ ഇവിടെ വെച്ച് കഴിഞ്ഞിട്ട്
എനിക്കറിയാമോ? ഇങ്ങനെ ചെയ്യാനുള്ളത് ഇത് പറയാനായിരുന്നോ തെറ്റുണ്ടായിരുന്നോ?
Inhale slowly and deeply through the mouth. Inhale slowly and deeply through the mouth while depressing the canister fully. Head back, tip the head back slightly, and inhale slowly and deeply through the mouth while depressing the canister. Then breathe in slowly and deeply through the spacer, normally through the mouth. Spacer device. Breathe in slowly and breathe in slowly and deeply. Breathe in slowly and deeply.
Ask the patient.
No. Ask the patient. Can you please can you okay. You have to breathe in slowly and deep.
Ask the patient.
Okay. Can you please tip the head back and breathe in slowly and deeply through the mouth while
tip head back. Tip head back slightly. Inhale slowly.
Tip the head back slightly and inhale slowly and deeply through the mouth while depressing the canister fully.
Okay.
Then then the next one, then you have to breathe in slowly and deeply and exhale through the mouth normally into the spacer.
Normally through the mouth into the spacer.
Normally through the mouth into the spacer. You have to do this 5 times. The 5th time you have to exhale through the pursley. That's it. Then you have to wait for 20 to 30 seconds for the next puff. That's it. Hopefully the constitution is alright.
ഇപ്പം 4 നോക്കി അതിൽ 3 നോട്ട് ടു ബാഡ്, 1 ശരിക്കും ഇമ്പ്രൂവ് ആണ്. ഇനി നിന്നെ നോക്കുന്നത്
ഞാൻ കുറച്ച് നേരത്തെ പക്ഷെ എനിക്കത് സൈൻ ചെയ്ത് വരാം സമയം വേണം. സൈൻ കൂടി ചെയ്തോ സമയം കറക്റ്റ്. അതിൻ്റെ അവിടെ തന്നെയാണ് അതിന് നെക്സ്റ്റ് പേജ് മുമ്പിലായിരിക്കണം. ഇഞ്ചി സാധന അപ്പാത്തിന് എവിടെ വെച്ചാണ് ചോദിക്കണം.
ചെറുക്കറിയോ ഇഞ്ചി മേടിച്ചിട്ടുണ്ടോ?
പ്രാവശ്യം ചെയ്തു
അറിയാവോ?
ചെയ്ത് നോക്കണം. സാധനം
ഇഞ്ചി വേറെ ദിവസം ചെയ്യലേ 8 minutes.
നീ അന്നേരം ഫീഡിങ് പറയണം. Checking for safe safety. There is no hazard. I am happy to approach the room for the patient's privacy and dignity. I am destroying the curtain. As my hands are visibly clean, I am just using the alcohol to clean my hands. Palm to palm, palm of the dorsum, fingers in the waist, fingers in the block, thumb protection, tips of the fingers, wrist to elbow, and I am allowing my hands to dry for 30 seconds. Um, Good morning. My name is Rashmi and I'm the nurse who is going to look after you today. I'm here to give you do a Peak Pro reading with you. Is that okay? Okay. Have you used this Peak Pro meter before? Okay. Don't worry. I will explain you everything. So, do you remember what was your last Peak Pro reading? No, you can't remember?
No.
Okay, that's all right. Is this pictometer belongs to you?
Yes.
Okay. So how long you have been using this pictometer for?
2 months.
Okay. The spectrometer can't be used for more than 1 year because there is a spring in the spectrometer. Because the spring will get damaged and it will give you wrong reading. After 1 year, please discard that one. And there will be a mouthpiece. I will explain you later as well. Because you are using for your own, you can just use that clean according to manufacturing instruction. So I have to just make sure that you are the right patient. I have to just confirm your details with my case note. So can I touch your wristband? Can you please tell me your full name? Date of birth? And hospital number 2244. And have you got any allergies?
No.
Okay. So I'm just going to prepare my articles ready. Before that, are you comfortable? Are you in any pain?
No.
Do you want to go to the toilet before I go and collect my articles?
No.
Okay, here is the call bell if you need anything. Okay, so I'm just going to do my hand hygiene and I'm going to prepare my articles. So I'm just going to keep my reading there and a case note and big prometer and the mouthpiece, and it's all clean and tidy. And it belongs to the patient itself, so I can clean afterwards. So I'm just going to first I'm going to wear the gloves. Just going to wear the gloves. I said I have to just show with the gloves. Okay, I'm just taking my trolley to the patient. Okay, are you comfortable? Okay, so you have mentioned to me earlier that you haven't used this one. So I will show you how to use this one. You have to connect this mouthpiece into the pictometer like that. Then you have to hang this one horizontally. Okay, then you have to place this mouthpiece into your mouth and make sure your fingers not come to contact with any of the boards, because it won't be a free flow. Can you see? So make sure that, and you have to be always in a comfortable position. You can do this one standing or sitting, which position you prefer.
Standing.
Okay. Okay. Can you please stand upright? Then you have to take a deep breath, deep exhalation, just deep breathe out. Okay. Then you have to hold the mouthpiece into your mouth like this and take a deep breath and make sure you seal this mouthpiece with your lips. Do not obstruct the airflow with your tongue and the teeth, because if you if the teeth and tongue obstruct the free flow of the air, so just keep this mouthpiece like this. Exhale fast out, then breathe in. So only hold for less than 2 seconds, so maximum of your lung capacity. Then you have to place the mouthpiece in and just do a quick, sharp, short, half, like that. Okay. Then I will put your point of posture. Sharp, short, half. Okay. So you have to do this one three times, and I will hold that one. There will be normally it will be 20 liter or per minute. It is a difference. If it is more than 40 liter per minute, I will ask you to do 2 more readings. Is if you are okay with that. Is that okay? Am I clear to you? Okay. So are you ready to do it? So just exhale out first, then keep the mouthpiece in and seal with your lips and breathe. Take a deep breath in and do a breathe out, short, sharp, off like that. Okay. So I have got the reading of 350. The first reading is 350. Okay. Are you ready to do the next one? Okay. Just do that again. Exhale out and short, sharp, half. Okay. The next result is 380. Are you okay to do the third one? Okay. Can you please do that? And I have adjusted the close to 0. Okay. So can you please do it again? Okay. And actually. So the result is 340. I will just record everything. Are you comfortable? Are you okay? I will let you know. So I have got 340. 340, 380 and 360. So the highest peak flow reading is 380. So you are male. So you are supposed to your height. Can you please tell me your height? Your height,
160. 160.
Okay, 160 and you are male. So it will be the maximum is 380. 160. So the pink line goes and meet and your age is you are 7
Okay.
Okay. 40, you are 40 and 160 centimeter. So so your maximum reading should be your maximum reading should be 600. So your maximum peak flow reading I have got is 380. I have to inform the doctor and they have to change some of your medication. Is that okay? And the difference between 3 readings are none of them are more than 40 liters. That's okay. So I will make sure the doctor has been informed. Is that okay? Are you comfortable? Okay, and so I have documented everything. I'm just going to remove my gloves and doing my hand hygiene. Thank you very much for your cooperation. I'm going to clean the peak flow meter and the mouthpiece and place it in your pod because it belongs to you. Otherwise, if it is between the patient, I will discard this mouthpiece into the bin.
Did you give the buzzer to the patient?
No.
You didn't give the buzzer to the patient.
Yeah, I didn't give the buzzer to the patient. Okay. Okay, here is the call bell. If you need anything, just ring the bell. Okay, I'm just going to do the hand hygiene.
സമയം കഴിഞ്ഞില്ല. സമയം കഴിഞ്ഞില്ല.
Because I have to explain to you. I have to explain to you. I have to explain to you. I have to cut that. ഒറ്റ പ്രാവശ്യം എക്സ്പ്ലെയിൻ ചെയ്യുക എന്നിട്ട് അമ്മ ക്ലിയർ ചെയ്യൂ എന്നിട്ട് നേരെ വായി വെച്ചാൽ ഇറങ്ങി ഇത്രയും നേരം 8 മിനിറ്റ് കൊണ്ട് ഇത്ര പ്രാവശ്യം എക്സ്പ്ലെയിൻ ചെയ്യാൻ പറ്റില്ല.
നീ ബസ് കൊടുക്കാൻ മറന്നു.
അപ്പൊ എന്നാ ചോദിച്ചപ്പോ എന്നെ പറഞ്ഞു മറന്നുപോയി. സമയം കഴിയും. സമയം കഴിയും.
അയ്യോ മടുത്ത് ലക്ഷ്മി.
ഞാൻ പറയുന്നത് പറഞ്ഞു ഞാൻ മടുക്കത്തില്ല.
നീ ഉച്ചയും കൂടെ നീ കെയർഫുൾ ആയി. നീ ലാസ്റ്റ് പോകുമ്പോ ബസ്സറൊക്കെ ഒന്ന് പുറത്തൊന്ന് പോയി കഴിഞ്ഞാൽ